Low-income countries, most of them in Africa, have received just 0.6% of all vaccines. We understand and support every government's responsibility to protect its own people. It's natural. But vaccine equity is not charity. It's in every country's best interests. No country can vaccinate its way out of the pandemic alone. The longer vaccine inequity persists, the more opportunity this virus has to spread and evolve in ways we cannot predict nor prevent. We're all in this together. We call on every member state to support the targets to vaccinate 40% of the population of every country by the end of this year and 70% by the middle of next year. 103 countries still have not reached the 40% target, and more than half of them are at risk of missing it by the end of the year, mainly because they cannot access the vaccines they need, and most of them in Africa. Even as some countries are now beginning to vaccinate groups at very low risk of severe disease, or to give boosters to healthy adults, just 1 in 4 health workers in Africa has been vaccinated. This is unacceptable. With emerging evidence of some waning vaccine immunity against infection, it's clear that in future countries will need tailored booster strategies. WHO's position remains that health workers, older people, and other at-risk groups must be vaccinated first in all countries before those at low risk of serious disease and before boosters are given to already vaccinated healthy adults. There is no doubt that vaccines have saved many lives and helped to quell the pandemic in many countries. Countries that have achieved the highest vaccination rates are now seeing a decoupling between cases and deaths. But in too many countries and communities, the bright light of vaccines has also become a blinding light to the continued need for other tools to stop this virus spreading, to stop it overwhelming our health systems, and to stop it killing. Vaccines save lives, but they do not fully prevent infection or transmission. Until we reach high levels of vaccination in every country, suppressing transmission remains essential. We don't mean lockdowns, which are a last resort in the most extreme circumstances. We mean a tailored and comprehensive package of measures that strike a balance between protecting the rights, freedoms, and livelihoods of individuals while protecting the health and safety of the most vulnerable members of communities. Ending this pandemic is not about vaccines or. It's about vaccines and. Excellencies, dear colleagues and friends, COVID-19 has now killed more than 5 million people, and they're just the reported deaths. The excess deaths caused by the virus and by disruption to essential health services are far higher. An unknown number live with post-COVID condition or long COVID, a condition we're only beginning to understand. Health systems continue to be overwhelmed. Millions have missed out on essential life-saving health services for non-communicable diseases and mental health. Progress against HIV, tuberculosis, malaria, and many other diseases has stalled or gone backwards. Millions of children have missed out on vaccinations for other life-threatening diseases and months of education. Millions of people have lost their jobs or been plunged into poverty. The global economy is still clawing its way out of recession. Political divisions have deepened nationally and globally. Inequalities have widened. Science has been undermined. Misinformation has abounded. And it will all happen again unless you, the nations of the world, can come together to say with one voice, never again. At its heart, the pandemic is a crisis of solidarity and sharing. The lack of sharing of information and data by many countries in the early days of the pandemic hindered our collective ability to get a clear picture of its profile and trajectory. The lack of sharing of biological samples hindered our collective ability to understand how the virus was evolving. The lack of sharing of PPE, tests, vaccines, technology, know-how, intellectual property, and other tools hindered our collective ability to prevent infections and save lives. And the lack of a consistent and coherent global approach has resulted in a splintered and disjointed response, breeding misunderstanding, misinformation, and mistrust. The fabric of multilateralism has been frayed. COVID-19 has exposed and exacerbated fundamental weaknesses in the global architecture for pandemic preparedness and response. Complex and fragmented governance, inadequate financing, and insufficient systems and tools, voluntary mechanisms have not solved these challenges. The best way we can address them is with a legally binding agreement between nations, an accord forged from the recognition that we have no future but a common future. Nations coming together to find common ground is the only way to make sustainable progress against common threats. It's not perfect, and it's not a panacea. It takes compromise. No one gets everything they want, but that's better than so many missing out on what they need.